By the time I was prescribed medications, my son had been fully weaned, as I'd had previous challenges with breastfeeding. So for me, feeding while on the unit breastfeeding wasn't a challenge because I had already weaned my son. But I understand it would be very complicated, or I imagine it would be very complicated for mums. It would be a difficult challenge of trying to manage breastfeeding in terms of feeling that that's safe and feeling okay about it. I imagine that would be quite a worry.
But breastfeeding also becomes quite a central sort of topic and a central part of a consumer's care when they are in hospital. And that's kind of looking at particularly balancing care and safety around breastfeeding. It can be a little bit tricky. So I think in my experience, it's been a little bit tricky sometimes because we have a whole range of varying experiences when it comes to breastfeeding. So we'll have people who are very actively involved and want to pump and want to breastfeed, but then we have to look at the flip side of that and saying, well, is it safe to have cords and things in the person's room? Are they able to actually organize themselves to pump? Or do we need to look at other alternatives? We also then look at sometimes we have cultural pressures or familial pressures or internal pressures for the woman to breastfeed when it may not actually be the option that she's wanting to pursue. And it may have changed with coming into hospital and with illness. The third kind of cohort where breastfeeding becomes a little bit challenging is when we have somebody who is really, really unwell and may not be able to make that decision at that time. So kind of looking at promoting, again, woman first care or person first care in trying to abide by whatever plan was in place before hospital, but also balancing it again with that psychological safety of not forcing someone to breastfeed, and then looking at other strategies for managing if they choose to stop breastfeeding while in hospital.
Sometimes fathers have a very strong opinion about their wives or partners having medication and then the baby also breastfeeding. So these are conversations that are had along the way when mum's able to have them and when the questions are raised, and we try very hard to answer these questions very clearly and provide information.
When I'm seeing a patient at 3 a.m. in the morning and they are breastfeeding, sometimes it's very difficult to make a decision then and there. Do they want to continue breastfeeding or not? And I think it's worth often making a plan to think about it for 12 hours, talk to the specialist team in the morning and make a decision then. And that can sometimes factor into what medications we choose or whether or not to use medication at all in that period. Often expecting mothers or breastfeeding mothers are understandably anxious about starting a medication and concerned about harms to the fetus or their child. Often they might have already seen their GP or heard from other people that they shouldn't use those medications, so have come off them suddenly. I think that's the role of the psychiatrist, is to have a rational decision about what the risks and benefits of using those medications are, but also what the risks and benefits of not using a medication are. And it's always important to talk to patients and explain that we know that depression in either the prenatal or the postnatal period will have developmental, cognitive, emotional, social adverse outcomes for their child.